Hello friends, I am Dr. Sandeep Bhasin from Carewell Medical Center. I'm going to start a series of talk on the reconstruction of nose, the aesthetic surgery of the nose, which is called rhinoplasty. So today in my first talk, I'll talk about what is the ideal nose like, aesthetically good looking nose, what qualities does it have. So let's start with that. So first is the length of the nose, and ideally the length of the nose is from the lower lip to the chin. If you take that length, approximate to that, the length of the nose should be approximately that. This length of the nose is usually between 3 to 4 centimeter in most of the people. And the height of the nose or the projection of the nose is 0.67% of the length of the nose, which means it is more than half, just half of the length of the nose. If the length of the nose is like 4 centimeter, the height of the nose should be like 2.2 or 2.3 centimeter, roughly 0.6% of the length. So that is something we keep in mind when we reconstruct the nose. So length and projection are very, very important for the nose, for them to look good. Next that comes is the width of the nose. Now when we draw two lines from the medial canthus or the inner canthus of the eyes and drop these lines down, the entire nose width should be within these two lines. If the nose is more wider than that, either the bony part or the ala part, then it is considered wide nose, and then osteotomy and alaplasty need to be done. So that's one point we always keep in mind, when we do the nose reconstruction and we do the rhinoplasty. Another very important point is the projection, the nasolabial angle. The angle between the columella, this part is called columella, and the lip is called nasolabial angle. In case of females, this angle is like 95 to 105, and in males it is 90 to 95. If this angle is less than 90, then it usually gives a drooping tip or the tip which is falling downward. If it is more than 105 degree, it gives a pug-nosed appearance. This we try to keep in mind. The width of the tip is usually equivalent to the width of the philtrum. The philtrum is, you look in the upper lip, these are called cupid lines, and the width between these two lines is called the width of the philtrum. So the tip is equal to the width of the philtrum, ideally speaking. If it is more, then we need to do the tip plasty. These are few things that we keep in mind when we are looking at the nose. And in rhinoplasty, what we say is, if we draw a line from the radix to the nose tip. Now radix is the point where the nose meets the head, or we draw a line from the radix to the tip. Anything that is below this line we need to increase, and anything above this line in the nose we need to remove. This is what we keep in mind in rhinoplasty. So what are the common techniques in rhinoplasty? Rhinoplasty is not one surgery. It has many techniques which is combining together to make a rhinoplasty to give you a good nose. So if you've got a very wide nose, then osteotomy, which means bringing the area around the nasal bone and bringing them together, can be done, or alaplasty can be done. So this area is called ala. So we do alaplasty and osteotomy to narrow the wide nose. Similarly, if the height of the nose is less, we need dorsal augmentation. So we need a graft that we need, and we call dorsal augmentation for that, to improve the height of the nose, to increase the projection of the nose. Let's come to another point. If the tip is not good, there is either too wide or too bulbous, then we do the tip plasty. That is called the tip plasty for the tip reduction. If there is a hump on the nose, then we do hump reduction. That is the surgery that is commonly done. So these are the common treatments that are done in rhinoplasty for the cosmetic treatment. Similarly, if we have got a crooked nose, the nose which is C-shaped or S-shaped or not straight nose, then proper septoplasty and septal reconstruction may be needed to be done. These are common modalities that we do in rhinoplasty. I'll talk about some of them in greater detail in my coming videos when I'll talk to you more about rhinoplasty. Thank you friends, I'm Dr. Sandeep Bhasin from Carewell Medical Center.